courtroom showdown today in Missouri could decide whether the state's last remaining abortion clinic gets to stay open. Planned Parenthood is suing the Missouri Health Department, alleging the agency was unlawfully holding up renewal of the St. Louis abortion clinic's license until the department completes an investigation into a patient complaint. The clinic's license is set to expire tomorrow, and Planned Parenthood is requesting a restraining order against the state in the hopes of keeping the doors open and avoiding service disruption. If the clinic's license is not renewed, Missouri would become the first state in the country without access to a single abortion service since 1974, of course, the year after the Supreme Court's landmark decision on Roe v. Wade. And joining me now is Dr. Leana Wen, president of Planned Parenthood. It's great to have you here in person. So tell me more about what's at stake here in this court case and the implications for the rest of the country.
Well, this is real. This is not a warning. It's not a drill. It's not hypothetical. We could face a situation tomorrow where 1.1 million women of reproductive age in Missouri will no longer be able to access abortion care, which is essential health care in their own state, and have to drive hundreds of miles round trip to Kansas to Illinois just to get health care. And I think it needs to be said that this is a real public health crisis, and that's why we're in court today, so that we can keep on providing essential health care to women in Missouri.
Explain in a broader sense the health care that is so critical. Now, will other Planned Parenthood facilities be open to provide non-reproductive services or non-abortion services in the state?
There are other facilities, including Planned Parenthood, that provide the full range of reproductive health services in Missouri, but only one health center that can provide abortion care left in Missouri. And that's because of regulation upon regulation that the state has issued that single out and target abortion care as something other than what it is, which is health care. I mean, the state has forced a 72-hour waiting period. They've mandated that hallways have to be a certain width, even requiring multiple invasive pelvic exams for women, things that are not medically indicated and actually are bad medicine. We've complied with all of these regulations because we want to provide medical care. But now the governor has said he signed a bill into law last week. That's one of the most extreme abortion bans in the country, with no exceptions for rape or incest, criminalizing doctors for up to 15 years for providing care. And now he's weaponizing the licensing process to try to shut us down.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.